This video is about food sources, deficiency symptoms, and toxicity symptoms of water-soluble vitamins. The first one has a name of beriberi, which is characterized by muscle weakness, loss of appetite, nerve degeneration, and sometimes even edema. What is the vitamin deficiency? Is it niacin, riboflavin, thiamine? Hopefully think of thiamine. What food would help to address this deficiency based on the ones listed here? The richest source of thiamine is found in the pork chops. So another situation, this deficiency, nutrient deficiency or vitamin deficiency, is known for the 4 Ds, so diarrhea, dermatitis, which is what's being shown here in the pictures, dementia, and death. What is a vitamin deficiency? And this one actually has a name as well. This one's called pellagra. And the answer is this is a niacin deficiency. What food would help address this deficiency? So similar to thiamine, niacin is found as a good source in pork chops. This next scenario is actually based on a real study. So this is published in Archives of Dermatology in 2016. And this is a 56-year-old man who presented with pinpoint bleeding, which is showing you here, pinpoint bleeding, and corkscrew hair, bleeding gums, and poor wound healing. A dietary assessment revealed he was consuming a diet that consisted only of snack cakes and frozen dinners. So think about the functions here. Think about the symptoms that we're seeing and how that relates to a function of a vitamin that we've talked about. So what is the vitamin deficiency? In this case, the vitamin deficiency is vitamin C. So hopefully you remember that vitamin C is involved in helping with connective tissue and collagen with wound healing and making sure that other tissues like the skin, the collagen is functioning properly in the capillaries, things like that, all the blood vessels. What is a deficiency name? Well, the deficiency name of a vitamin C deficiency is called scurvy. What foods would you recommend in order to address this deficiency? Citrus fruits, dairy foods, or grains? Vitamin C is known to be very high in citrus fruits, so that's what we want to recommend. Okay, our next scenario. A middle-aged male presents with cracks and redness at the corners of his mouth, like shown in this picture. Patient reports his tongue was hurting and looked different than normal. Further assessment noted a smooth, swollen tongue. What is the vitamin deficiency? Well, this, along with the smooth, swollen tongue, is a classic sign of a riboflavin deficiency. So what food would help to address this deficiency? Milk, white rice, or corn? The answer is milk. And something interesting about riboflavin is it has a sensitivity to light. So UV light will destroy the riboflavin. This is one of the reasons why milk is stored in cardboard or opaque containers rather than glass, because we want to help maintain the riboflavin that's present in milk. Our next deficiency. An infant was born with spina bifida, a type of neural tube defects, as shown here in the image. Mom indicated that during pregnancy she ate a diet high in animal products and limited grain intake. She also stated that she usually forgot to take her prenatal dietary supplement. What is the vitamin deficiency that would be related to the formation of a neural tube defect called spina bifida? In this case, this is a folate deficiency. So folate is responsible for helping that closure of the spinal cord to be able to close in so that we don't have it exposed, and so it doesn't lead to nerve tube defect. And it's important that mom actually gets this within the first 28 days after conception. So I really want to emphasize that, because a lot of times women don't know that they're pregnant before at least a month after they have conceived. And so it may be too late for folate as far as preventing neural tube defects. Folate is important in the entire pregnancy, but for preventing neural tube defects, you need it in that very critical period of the first 28 days after conception. So we recommend that all childbearing age women, so anyone who has the potential of becoming pregnant, make sure that she is consuming enough folate in her diet. So what foods would not have helped to address this deficiency during mom's pregnancy? And the answer is chicken and fish. So folate is naturally found in really high quantities within leafy green vegetables. And then we also find them naturally in grains and legumes, specifically whole grains. But remember, we talked about that enriched grains actually have more folic acid, which is the fortification form. So folate is a natural occurring form. Folic acid is the fortification form. And they add more back to grains than were even present in the whole grains. So why we want to have half of our grains being whole grains and half being enriched grains, especially for women. Here's another situation. A college student had a blood draw taken as part of an annual physical exam. A vitamin deficiency was suspected based on the results. Thus, further tests were used to evaluate the red blood cells. They were noted to be enlarged or having megaloblastic anemia. The college student reported practicing a vegan lifestyle. What is the vitamin deficiency? So in this case, the vitamin deficiency is vitamin B12 because B12 is only found in animal products. So someone who is vegan is not going to be consuming any animal products, therefore is likely going to have a lower vitamin B12 intake. This is from your book showing you what happens with red blood cells. So we see that with the vitamin B12 deficiency or even a folate deficiency, we see red blood cells not dividing like they should, and they become enlarged and they don't function the way they need to. What foods would you not recommend to address this deficiency if you wanted to increase B12? Well, the best sources of B12 are the beef and chicken and dairy foods. Now that would be tricky for someone who's vegan. So someone who's not vegan, we want to make sure they get animal products in their diet to get B12. If they are vegan, we have to start thinking about supplements or getting it fortified into grains, looking for it fortified into grains. Now let's think about some toxicity of water-soluble vitamins. This is a real case that was published in the MMWR Morbidity and Mortality Weekly Report from the Centers for Disease Control and Prevention. This is many, many years ago, so 1983. But this is one of the situations that occurred that help us to establish a toxicity of this particular nutrient. So on April 27, 1983, 14 or 20% of 69 persons attending a brunch had acute onset of rash, psoriasis, and sensation of warmth. Symptoms exhibited approximately 30 minutes after consuming bagels. The bagels had been produced at a local bagel factory from a batch of dough originally prepared on April 23rd. Because the pumpernickel bagels were very light in color, the ingredients were suspected. Investigation revealed that in an attempt to enrich the pumpernickel flour, a large quantity of this nutrient had been added, apparently from an improperly labeled container. Laboratory studies revealed 60 times the normal level of this nutrient in the pumpernickel flour. Each bagel contained approximately 190 milligrams of this nutrient. So what is the vitamin toxicity? This is actually a niacin toxicity. So we know that individuals who get high doses of niacin are going to actually have this rash and redness that occurs related to that toxicity. Another toxicity, excess supplemental intake of this nutrient may mask seeing a vitamin B12 deficiency. Well, hopefully you remember not too long ago and a couple of slides ago that we talked about vitamin B12 and folate interacting. So the answer of this is folate. So if you've got too much folate, and it may in fact mask a B12 deficiency because folate and B12 go hand in hand in their functions. If you're really low in B12, but they thought that you were low in folate and they gave you folate but didn't give you B12, you're eventually going to see some more negative consequences with B12 long term, so nerve damage, and you're going to have issues with DNA and some other things related to that's very kind of neurocognitive functions. It's related to B12 deficiency long term. So if someone does have those enlarged red blood cells, they're going to give them supplements with folate and B12 just because they may not know exactly which vitamin deficiency it is. And there are other tests they can do, but they're quite expensive, so they might just supplement with both. So that's the end of the water-soluble section. If you have questions on any of this, please let me or the TAs know.